The issues behind the headlines, of course, a big discussion to do with the Sharon Otieno's killing, and that matter is still under investigation, so we'll leave it there. Before we move on to what's happening at the Nairobi County Assembly, let's talk about this issue to do with mental illness, why affairs of the heart and mind push up suicide rates. One governor says suicidal tendencies are worsened by stigma when mental patients are described as being mad. Now, most suicide cases involve young people battling depression as a result of love affairs turned sour, joblessness, or family disputes. Now, this is according to Director of Mental Health, Simon Juguna. This discussion comes about because on Monday we're marking World Suicide Prevention Day. Now, we're talking about young people, ages 15 to 29. These are fairly young Kenyans. Well, that is the figure, that's the age globally affecting people who commit suicide. But when it comes to Kenya, because these stories rarely get to see the light of day, because a story about murder would get priority in the news, even on the dailies, but suicide rarely gets a headline. But it speaks a lot to the current situation we have, probably economically, socially. Kenyan youth are suffering. Kenyan youth have even opted to take their own lives, probably because of love gone sour, probably of lack of economic empowerment, there are no jobs and all these things. But as a country, are we taking this seriously, that Kenyan youth are actually suffering to the point of taking their own lives?
I don't think so. I mean, I think actually the numbers are shocking, that suicide is the second leading cause of death between 15 to 29-year-olds globally. And then 4 to 5 Kenyans are committing suicide every day. Yes. I mean, if we took this seriously enough, then we would be emphasizing mental health as much as we emphasize HIV and AIDS, or right now non-communicable diseases such as cancer and so on, the focus that we are putting on these matters. But I don't think we have put sufficient focus on mental health and just mental health clinics and being able to encourage people to speak with each other. I mean, people focus more. If I came here limping, you know, you'd ask me, what's with your leg, you know? So we haven't focused enough on mental health as a country, and I think this is a warning, a big warning sign. Our Ministry of Health must now put programs, especially public education programs, on how do I discover, how do I see that my child, for example, or my brother or my sister or my colleague is suffering depression or schizophrenia or any of these other elements that would lead to suicide. Because we can be sitting together, laughing together, but I can't tell, because there's no awareness generally. I can't tell that my brother Cherargei, or he can tell that I am going through some difficult time. And
just looking at the number of headlines we look at about a spouse killing spouse and then committing suicide, those are quite a number, and I'm sure if I go through the dailies today, chances are I might encounter one of them. But with all this reawakening and the discussion about universal healthcare, it's part of the Big Four agenda. Everyone is talking about we should be able to get universal cover and all these things as far as health is concerned. Do you think that at the back of our minds we're even thinking about mental illness?
Not quite. In fact, when Gladys was talking about, coming to the studio limping, I remembered my brother Cherargei was just limping the other day. now he looks quite okay, and everybody in the Senate was caring about him. The issue about mental health is very serious, because we have this connotation that if you kill yourself, it is you who wanted to kill anyway, so you should go to hell and suffer the consequences. Or that if you have a mental health issue, you are a mad person. And so you do not deserve, really. And yet, increasingly, with the breakdown of our social support systems, and we're increasingly becoming individual contractual, where you get a job and it's up to you and your issues. When you don't succeed, with the social media craze about, doing it well, you are doing well, and trying to, to do shows that they make you look very good. People then feel they are left out. That is something that is increasing, and you can see these are young people. So the effect of social media, and we need to investigate that, and the lack of approval by the society for whatever reason, including not even getting the person that you may be able to love, but also the issue of mothers, post delivery depressions, issues around that. People don't talk about it, but those are some of the things that are making, our young women to be vulnerable. Issues to do with how to resolve, marriage conflicts, because those structures are no longer there. So the issue here, Fred, is really also about people ignoring the signals. When somebody says they feel suicidal, we tend to tell them, brush off the idea. We don't take them seriously. Or if somebody says, I want to kill yourself, kill yourself. You think we will care? The world will move on without you. Those kind of things. So we need to start having conversations around how to create support mechanisms for people who are under this challenge. And most importantly, even budgeting and having structures where people can even call, when you feel like you need to talk to someone. Because, by the way, Mother Teresa says, and I would want to quote, that the problem in this world is not because people, are poor or sick or all of those. It's because of that feeling of unwantedness. Nobody wants you. You are unuseful. You don't matter. So we have to have a way where people can ventilate and so that you are able to resolve the problem. There are also some medications. That if, for example, you're suffering from a certain ailment, they also they create a depressive mood, and people are not even told, so that you find, somebody is under medication but reacting as in an interesting way, and then nobody is there to support them. So it is a whole new area. We may even need a whole topic to discuss about this. And
as far as the Kenyan society is concerned, there's also a lot of stigma associated with mental illness. It is very easy for you to seek help from a dentist, a gynecologist, or anyone else, but if you're told to go see a psychiatrist, I'm sure you will get offended, probably, or a counselor. But the fact of the matter is, someone commits suicide every 40 seconds globally, translating to about 800,000 annually, while up to 25 times as many attempt suicide. That means the numbers could be higher. It's only that they are not successful to kill. But in Kenya, and according to this doctor says, he has listed loneliness, hopelessness, and rejection by family members and society as some of the triggers that drove addicts to take their own lives. That's in as far as addiction is concerned. But don't you think that the stigma associated with mental illness does not even allow us to discuss that issue? That if you look depressed, you would not even be able to discuss that matter with anyone else?
I agree. I think it is very important. Personally, I have interacted. I have a relative who has mental problems, and it has been an issue for very long years, and there is a very weak support system to such people. And I think, in fact, the other day, I think 1 year ago, we went and we were told the Ministry of Health has scrapped. They used to subsidize the payment and provide the necessary medication for the people suffering with mental health. But it is very sad that most of the young people, because of social pressure, peer pressure, media grace, and all all those issues has forced many young people to go to suicide way. And I think also as a society, the social fabric is getting weak also. And we are reaching a level where we are saying bora uhai. You don't care about anybody. I agree with what Gladys has said, that we care. We don't know what people undergo through that has forced these suicide thoughts that we have. And I think as a country, it is the right time now to sit and look at the mental health, because some of these cases, it could be a problems that emotional, it could come with the family, it could be because of medication, as Senator Maura said, it's because of many perceptions that we have in the society, it could be love triangle issues, it could be so many issues that people are undergoing through, that now, even at the level, and I suspect in this, although I've read on the overview of this, I suspect most people who commit suicide are men. It is because we don't get open as many as women. We don't discuss. And I think even in our schools, I have seen the Ministry of Education before has insisted on counseling and training. And I remember during my time, although it was not strong enough, that we could be trained through the peer counseling, and therefore, and I think that the Ministry of Education should now strengthen, because some of these cases, if it is between 15 years to 29 years, therefore, they could, and I'm happy I'm almost getting out of that bracket of committing suicide, because 15 to 29 years.
Well,
so the issue is, we could even, in the higher education learning institutions, I think we should create more agreeing peer review mechanisms to ensure that we protect young people, especially even what is happening to Sharon case, for example, and many issues of sponsors, sponsorees, sponsors, and all these aspects that we are having in the issue of slay queens and anything else is because they contribute a lot because it's a social pressure. When you are not having the latest phone, when you think you are sitting and somebody is having a more expensive phone, maybe Note 9, and maybe you're having a Sony Ericsson, or you don't have a good shoe. You know, that social pressure within a setting of peer pressure can lead to somebody thinking that society the life is unfair to
What
them.
about the cost of treatment and even availability of help? Because probably, and this is where maybe as legislators you would come in.
Yeah.
Because yes, I've had an opportunity to talk to a councillor on an occasion or the other, and the amount of money I had to pay was very prohibitive.
That's right.
It's out of reach of many people, and probably that's where the problem is. It is easier to consult even an orthopedic or a gynecologist as opposed to a psychologist.
Yeah, I think availability and access to healthcare, of course, is an issue across board. But now, when it comes to mental health, it is worse. In fact, it is worse than even cancer, which we have, really now tried to speak about, and we are saying, can we have oncologists in our, county referral hospitals, and in our level 5 and level 4 hospitals as well. But mental health, we haven't spoken about it enough, even as legislators. So when we talk about affordability and access, and even whether people really think they need it, just the awareness around it, we have to do. There's a lot of work that needs to be done. So in my view, as legislators, it starts from there. I mean, the ministry should be working around it, and they should bring proposals to Parliament.
But you do agree even Parliament itself is not really...
No. There's work to be done.
It's not something you've embraced. It's not even something you've considered.
Yes.
When it comes, even when you're scrutinizing budgetary appropriations, the issues of mental health are not really a big problem.
That's true.
In the 11th Parliament, in the National Assembly, I presented a bill, an amendment to the Marriage Act. It was, we are actually making the marriage bill. We are consolidating. And then I suggested that people with mental health illnesses can also give consent to marriage, because sections, clauses 11 and 12 of that bill were almost outlawing that they cannot get married. And you see, mental health is a very broad area. You could be having bipolar, it could be schizophrenic, whatever can be intermittent. It's not all the time. Sometimes you're lucid, sometimes you're okay. Somebody stood there, actually the leader of majority, and said, we cannot allow mad men and women to get married. That is the attitude you get from people.
From legislators.
From legislators. So if today you are to introduce such matters, people think they are peripheral. They are not. In fact, I want to congratulate Gladys, because she stood very strongly on issues of oncology. So we do not have, because then you get the pushback and you feel like, okay, for me, I was also coming from the disability point of view, representing all types of disabilities. But mental health is not necessarily within that ambit of disability. Anybody can have a mental health issue. So we need to seriously think about this, and I think this is a wake-up call. It's the first time, even for me, I'm hearing there's a World Anti-Suicide Day. So that then we want to ask the Ministry of Health and even individual legislators that they can bring this matter to the floor and see what is it that we have within the ambit of our national health system.
Yes. Well, World Suicide Prevention Day was marked on Monday this week, but even as you can hear from our legislators, it is not something that even our Parliament has embraced. And that just goes to show the kind of problem that we have with 4 to 5 Kenyans committing suicide every day. Wow.